Well, this week we saw Australia Day honours and handed out once again, recognising those who provide outstanding community service. A large number of the recipients are traditionally involved in the public health sector, and this year was no exception. Now, one of those honoured was Professor Tony Cunningham from the Westmead Millennium Institute. He was appointed an Officer of the Order of Australia for his service to medicine, particularly in the field of viral research, and joins us live in the studio. Tony, first of all, congratulations to you. An honour very well deserved.
Thank you very much, Nina.
First of all, tell us more about the work that you do and the Westmead Medical Institute, which you indeed founded.
Yes, the work I do is viral research. These funny little bugs that actually grow in cells and alter those cells in our body to either cause cancer or cause deficiencies of the immune system like AIDS. So they are extremely small but very nasty creatures indeed. And the Westmead Millennium Institute has been in existence for about 13 years, and we do more than viral research. We work on cancer and we work on diabetes. We work on some of the most important diseases found in Australia and in the world.
Indeed, medical landscape is such a vast one. What made you decide to narrow in on this field?
Well, I've always been interested in infectious diseases since I went to New Guinea and looked at just what havoc infectious diseases can wreak, I guess, in the third world. And I then became fascinated with these tiny little bugs that can alter the whole of the system, cause hepatitis, cause cancer, cause AIDS. I really became very interested in that particular line of work through infectious diseases.
Of course, you developed the first successful herpes simplex vaccine. Tell us more about that.
Well, I did some of the research both at Stanford University and back here, identifying some of the important cells in humans that are involved in controlling against herpes, which of course causes blindness and also death in babies, as well as other more well-known diseases. And those discoveries were really translated into a vaccine candidate by one of the world's biggest vaccine companies that I joined the board to advise them and help develop the vaccine, and ultimately trialled it. And that vaccine candidate has been the first successful vaccine candidate ever developed for this really difficult virus. Still yet to be deployed in practice, but it's looking quite good.
Hopefully not too far away.
Yeah.
Now, your studies also showed a link between herpes and the HIV virus.
Yes, well, the first work that I did showed that the very cells that lie in the base of an ulcer caused by herpes are those infected by HIV. And my colleagues in the USA translated that discovery and showed that infection with herpes can enhance the acquisition of HIV 3 to 5-fold. And so it's really very important to see if we can control both of these very nasty viruses.
A huge honour, of course, receiving the Australia Day recognition. When you look at how Australia fares on the international scale when it comes to medical research, how do you think we're placed? How do you think we're doing?
We definitely punch above our weight. The figure that we trot out is 0.3% of the world's population and 1.5% of the effective world's medical research. So we have leaders in all disciplines in medical research in Australia, and we can be proud of our National Health and Medical Research Council, which actually funds most of our research, and we can be proud of our youngsters who go over and train in the USA, and we've really got to make sure we get all of them back. So there's still a lot to be done. We really don't support research in some ways, particularly institutes and how they work in this country, and we're working on that.
Can I just finish by asking you about H1N1, of course more commonly known as swine flu. The hype around this, if I can use that word, seems to have died down a bit, but do you think we're too complacent?
Yes, I think this particular type of influenza has been affecting young people. And I've heard a lot of people say, oh, well, there is too much hype. But the other types of flus actually kill elderly people. Because this affects young people, it doesn't kill as many. But 9% of the hospitalisations last year in ICU, in intensive care units, were pregnant women, and we've seen many deaths in young people. We can't be too complacent.
Tony, congratulations again. Thank you so much for coming in and sharing your knowledge with us. Much appreciated.
Pleasure, Nina.
Stay with us. Coming up on Health Report, it must